Thank you for being here. You brought along with you Carolyn Williams, who is your patient, and you're going to talk to us a little bit about a procedure that you did for her. So welcome to you both.
Thank you.
Okay, let's talk about this reversing diabetes thing, because this is one of the things that you had, and you had it for years, about to go on the insulin pump. So you were extremely high with your insulin, and Dr. Sharma reversed it.
He did.
Okay, how do you do that?
Well, everyone knows the harmful effects of diabetes, and they are catastrophic.
Right.
There are certain operations, and the newest one is called DS, duodenal switch, and it's a complex reconstruction where we change the plumbing, and essentially the effect is very dramatic. The diabetes is cured.
Is cured. The diabetes
yes.
is cured. Okay.
And it takes about 48 to 72 hours. And when I say cure, I mean no insulin, no oral medication, no diet control, and your sugar stays less than 110.
Okay, and the living proof is right here. And tell us, we have some pictures of before surgery and the way she looks now, which is amazing. This really works.
It does really work.
Okay.
It even surprised my doctor because I had...
now that's you with your husband, right?
Yes.
Wow.
And at that time, my A1C had gotten down from a 13 to a 7.9. And so when I went to see my doctor, that was in December when it was at 7.9. When I went to go see my doctor for my follow-up in March of this year, just a few months later, it was down to 5.2. And he sat there and he goes, well, okay, you can come off all your medications now. And I said, you don't understand. I haven't been on medication since I had this surgery.
And he was shocked.
He was shocked because he didn't know that he didn't understand the surgery because he hadn't really heard about it. But he didn't realize that it was going to do that to my blood sugars, to have them drop that well.
So not only
medication.
And you've lost how much weight? Because in some of those pictures, at least the first one with your husband, what was your weight then?
That my weight then was 229, and so now I'm down to 164.
Excellent.
Yeah.
So not only did you lose the weight, but you were able to reverse the diabetes, and so you're healthier.
I'm healthier, and that's one thing that I keep telling everybody. The weight loss is just really a great benefit from it, but at the same time, my success is having no diabetes, not being on insulin or oral medications anymore, having low blood pressure again, not having to sleep with my CPAP machine anymore. Those are my successes, you know, and having my health back, feeling normal again. That's what I'm really proud of.
And Dr. Sharma, you made this work. We have a slide of the actual procedure that he performed. Now this is almost like you're redoing the internal plumbing. This is the procedure that you perform that reverses the diabetes. Explain to us what we're seeing right here.
I'll briefly explain. What we do is, one of the operation is kind of a sleeve where we change the stomach shape. Instead of being a football-shaped stomach, we change it to a banana-shaped, a little larger than the sleeve. So these people are a little restricted, but still they can have good meals.
Okay.
And the second portion is we make two separate channels, one for bile and digestive juice to travel, and which you see green on the right side, and the other one, the red, which is coming from the stomach, is the food which you are eating. And as you can see, these two are not mixing together till at the very terminal part of the intestine, where the food mixes with the digestive juice and starts absorbing the calories and nutrients. So a lot of malnutrition also takes place. But essentially what it does, it gives rest to your liver, which in fact is producing very high concentration of sugar in your blood. And we try to establish a harmony between the pancreas and the liver so they work together. And the result is very dramatic. You see that sugar has gone down.
Okay, and it's really just because you're separating things coming out of the stomach. So things are going in different directions. So your bile is going one way, and then the nutrients from your food is going another way. And you say that by doing this, it allows your liver and your pancreas to live in harmony, and they're not working against one another or so forth. How does that work?
The food actually is now not touching the pancreas. It's bypassing the pancreas through a separate channel. And there are many proteins what you eat, and they produces, when they reach that portion of the intestines which is connected to the pancreas, it produces a lot of factors we call anti-insulin factor. They work against the insulin. So all of a sudden, when the food is not reaching, all these factors dramatically drop down.
Wow.
And so the insulin starts acting effectively, and we see the obvious results.
It's amazing. And Dr. Sharma has been in before with another patient, similar situation, and the diabetes just reversed. And what shocks me so much is that a lot of people, their normal physicians don't even realize that this can happen.
Yes.
Is it just that they're not aware of this kind of a procedure, or this type of a procedure?
There are many reasons for it. First, not many centers offer this operation. We are one of the few centers in the country which is offering duodenal switch. Second, everyone is scared of surgery. No one wants surgery, so they just don't look at that option. However, we do this surgery in a least invasive way by making tiny holes, and honestly, the patient can go home in a day or so, and the recovery is much faster. There is lack of awareness. It's not an investigational procedure. It's well established. There is enough scientific data which proves the benefits of this procedure, not only in curing diabetes, but other medical conditions. And we just have to create more awareness.
I was going to say just more awareness.
So that patients who are fighting with diabetes, harmful effects of diabetes, at least they can consider they have an option to cure and get more educated about it.
And the weight loss is really just a secondary benefit to the whole thing. The main thing is you're healthier, and it's an amazing procedure that you're doing, and we need more centers like yours. New Life Bariatric Associates right here in Jacksonville, and of course the web address is on the screen. So good luck to you.
Thank you.
Thanks for coming in, both of you.
Thank you.